Hi, I'm Cindy, and today I want to talk about understanding arthritis because it's more than just wear and tear. Because when most people hear the word osteoarthritis, they immediately think of aging, stiffness, and joints that just worn out. It's a term that gets used a lot, but do we really understand what it means? So let's take a closer look at what's actually going on inside the body when osteoarthritis develops and why it's not something you simply have to accept as part of getting older. So, what is osteoarthritis? So, osteoarthritis is often shortened to OA, and it is the most common form of arthritis. It can affect many joints in the body, but it most commonly shows up in the knees, the hips, the hands, and spine. So, in a healthy joint, we have a layer of cartilage that cushions the ends of your bones, helping them glide smoothly and absorb shock. With osteoarthritis though, this cartilage gradually wears down over time, and when that cushion thins or disappears, it can lead to pain, stiffness, inflammation, and reduced movement. But here's something that's often missed. Osteoarthritis doesn't actually happen overnight. It develops gradually, often over years and years, and is usually the result of accumulated stress, imbalance, or dysfunction in how the joint has been moving or weight bearing. So yes, while age can play a role, it's not the only factor, because I've seen people in their 30s and 40s who are showing signs of osteoarthritis. And then I've also seen people in their 70s with minimal degeneration, because it's not simply a matter of age, it's about how your body has been functioning over time. So more than wear and tear, the phrase just wear and tear is something I hear all the time. And while yes, it is partially true, it oversimplifies what is actually a complex and adaptive process, because joints just don't wear down for no reason. They respond to how your body moves, how well are the surrounding muscles are supporting them, and also how efficiently is the nervous system coordinating everything. So if one area of your body isn't moving properly, say due to poor posture or past injury, other areas may start compensating, and over time this creates uneven pressure on certain joints, which can speed up the degeneration process. So osteoarthritis isn't just about getting old or using your joints too much. It's about how you use your body and how well it's being supported from the inside out. So early signs to watch out for, because osteoarthritis develops slowly. The early signs are often subtle and easy to dismiss, but paying attention to these can help you take action before it becomes more limiting. So some common signs include joint pain, especially in the morning or after rest, pain with movement or activity, a clicking or catching or grinding sensation in the joint, swelling or tenderness, decreased range of motion or flexibility. These symptoms might come and go at first, but they are often brushed off as normal, but they're actually early signs that the joint is under stress. So, what contributes to osteoarthritis? There are a few key factors that can increase your risk of developing osteoarthritis, such as having an injury in the past, like even the minor ones that didn't seem serious at the time, also repetitive strain, poor posture, spinal misalignments that might lead to imbalance in the muscles and joints loading, a sedentary lifestyle, lack of movement. But in fact, none of these factors even guarantee that you'll develop osteoarthritis, because the body's resilient, it's adaptable, and especially when it's given the right support. So you don't have to wait until your joints are severely worn down to take action, because in fact, the sooner you start, the more effective your results can be. So supporting healthy joint functions means looking at how your body is moving as a whole, not just focus on the joint that's hurting. So improving your posture, alignment, muscle balance, nervous system function, all help reduce unnecessary stress on these joints. These are areas chiropractic care can directly support. It also means building habits that promote joint health, like staying active, eating nutrient-dense, anti-inflammatory foods, drinking water, staying hydrated, and allowing time for recovery and rest. So yes, osteoarthritis certainly is common. However, it doesn't mean that it's inevitable or it's normal. And even if you've already been diagnosed with it, there are still ways to slow down its progression, reduce pain, and regain your confidence again in your movement. This is just the beginning of the conversation. There's so much more to explore, like how to recognize the different stages of osteoarthritis, what treatment options are available, and how to build a plan that supports your body for the long term. Because your health isn't just about managing symptoms, it's about creating freedom, resilience, and a better quality of life.